Welcome. My name is Nikki Young, and I'm a program manager with the Child Neurology Foundation. Today's talk is part of our ongoing series highlighting children and families as they navigate their new normal living with a neurologic condition. These sessions bring together caregivers and health professionals to have a candid conversation and share their expertise with the child neurology community. Today, we are discussing a rare disease, TANGO2, with a parent, Ebony Hill, and physician, Dr. Samuel Mackenzie. Welcome. Thank you so much for joining me today. We're so excited to hear your perspective.
Thanks so much, Nikki. So my name is Sam Mackenzie. I'm a pediatric neurologist specializing in neuromuscular medicine and rare neurogenetic diseases affecting children. Today, we're going to talk about a condition known as TANGO2 disease, sometimes referred to as TANGO2-related metabolic encephalopathy and arrhythmias, sort of a mouthful. If you found this video, there's a good chance you may already know or care for somebody with TANGO2. So this is a condition that's autosomal recessive, meaning that it requires a problem in both copies of the TANGO2 gene for symptoms to manifest. We all have two copies of TANGO2, one from our mother and one from our father, and both of these copies need to be changed in some way to make the protein that the gene codes for either messed up in some way or absent altogether. We use a range of genetic tests to arrive at the diagnosis, including single gene sequencing, whole exome sequencing, or sometimes chromosomal microarray. Now, the symptoms of TANGO2 disease can come on in a variety of ways. Children usually have some degree of developmental delay with or without regression, meaning kids can actually lose skills as time goes on. They may have seizures, ataxia, meaning they appear off balance or unsteady. They can have increased muscle tone, especially in their legs. Children can also have what we call metabolic crises, which means they aren't able to maintain the energy pathways that their cells need to function properly. And this can result in low blood glucose levels, breakdown of muscle fibers, which we call rhabdomyolysis, and dangerous changes to how the heart beats from an electrical standpoint. So to date, we don't really know what's happening in the body in patients with TANGO2 related disease. The mechanisms are still being worked out from a lot of different angles, and we think there's a good chance that the TANGO2 protein plays some role in mitochondrial function. Mitochondria are like little power plants in our cells, and if they aren't working properly, our cells may shut down or die. We think that's what leads to so many of the symptoms that I talked about earlier. Similarly, we don't have any cures for TANGO2 at this point in time, though we do know it's important for children to eat on a regular basis, which I think Ebony's going to discuss with us today. Follow with the medical team, and that's going to include multiple different specialists, and most importantly, seek urgent care if something seems off with your child. So I'm delighted to say that today we're going to speak with a mother of two children with TANGO2 disease and learn more about her family's perspectives living with this condition. Ebony, it's such a pleasure to be able to talk with you today.
Thank you.
So, Ebony, you have two boys with TANGO2 disease. I wonder if we could start off by having you walk us through your older son's diagnostic odyssey. What was the sequence of events that led to the diagnosis?
Orion is my oldest. He was born at 42 weeks, normal birth. He had his umbilical cord wrapped around his neck, and they put him in NICU for about 2 to 5 hours for low sugars, but they brought him back and said everything was fine. He then, for the next 9 months, was only breastfed and did not lift, was barely lifting his head. Because I was a new mother, I didn't know about that not being normal. So, and no one else said otherwise. So I just went on. And then the next few days after he was 9 months, he went into cardiac arrest. We brought him into the hospital, and they found that he had arrhythmias, that his heart was dilated, and he spent about 5 days coding off and on with cardiac arrest off and on. And we were offered to go to a hospital with more specialists. At this hospital, we got a little bit tighter care and with more doctors of expertise versus just cardio and neuro, which we had at our local hospital. There we got him, we were able to be discharged at about 4 weeks later with an NG, 12 different meds, in-home house care, and a few nurses, one nurse for sure, two I think for a moment. Follow up with genetics. Well, we had genetics, neurology, and I'm not sure who the third one was. And neuro said everything was good. He had a brain damage from lack of oxygen from the cardiac arrest. And then when we went to the neurologist, or the genetics, when we did genetics, they told us that it looks like a metabolic disease, but we're not sure. But we are treating it with metabolic medicines. And then we were discharged from those doctors. So that was at about the 1 year mark when he was 1 year old. I went on to figure out what metabolic disease was and what mitochondria disease was, that's another word for it. And in doing my research, I learned that it has to do with processing foods, maintaining a proper energy level, how the body digests and absorbs things. So in my choice, I decided to just go organic and test out in my own forms what type of fats I was trying to not serve. So with the organic diet, I learned that low fats worked for my oldest, and he maintained that diet for about 3 years. It wasn't until he was about 4 years old before he got his diagnosis of TANGO2.
Do you happen to remember, Ebony, what sort of genetic testing was done before they were able to give you a diagnosis?
Orion received none until Osiris was born.
Okay, so Osiris is your younger boy.
Yeah.
And at this point, it sounds like people were thinking this is something metabolic. We don't know what it is. Do you remember the term fatty acid oxidation?
Doctor told me it's either metabolic or this is just a fluke thing that happens every once in a while, and it just so happened to happen to you.
Okay. All right. Well, yeah, carry on. So where did things go from there? I know this has already been a whirlwind, and to not have answers must have been frustrating.
Osiris was born once Orion was 2 years old. And I noticed during the pregnancy, because I'd learned so much about mitochondria disease, that what I was eating was working along well with the mitochondria diets.
Mm-hmm.
So I figured that something was kind of up. Once he was born, I worked my way to get an echo and EKG, everything but labs, just as Orion needed during his metabolic crisis, and I almost got all of those at birth. They all turned out fine, so I thought things were all good. And then the metabolic screening that every child gets at birth. Then at about 2 months, I started teaching him sign language. He only wanted to say eat, and he was only ever happy whenever he was eating. By 5 months, he had his first metabolic crisis. The ambulance came to the house, and we found out his sugars were below 50. And we were thinking, me and the EMS were thinking he was having seizures. So we brought him into our local hospital, and because they remembered my oldest so well, they already knew, ER and ICU staff all knew what to do immediately. So Osiris spent about 4 hours tops at our local hospital, and he was live flown to the hospital with the specialists. And because everyone remembered that care so well, all the doctors got to spend a majority of their time trying to figure out what this issue was instead of treating it, since they had experience treating it once already. After 4 weeks at the specialist hospital, we finally got the name TANGO2. Doctors came in and told us, we don't know anyone with this, but this seems to fit pretty well between both boys. So they gave us a protocol paper that says suggested TANGO2, and we kept that protocol and used it until we got our proper diagnosis with the lab, or I guess it would be labs, blood drawing in the next 3 months with the follow-up genetics doctor.
I think at the time, Lilani there was only the one article about TANGO2.
Yeah. And at that moment, whenever we got the TANGO2 suggested protocol, we were also handed one article about TANGO2, and that was the only article ever written about TANGO2.
Right. So I can mention here that, this disease was only really only came to light in 2016.
Yeah.
So it's a fairly new condition. It's probably been around a lot longer, but not one that a lot of neurologists or other specialists are even aware of. Yeah, I think that. So did your boys have muscle breakdown? Do you recall? Was that what kind of prompted that being considered?
Rhabdomyolysis. They both had the rhabdomyolysis. I just bunch it all into metabolic crisis.
Right. No, and I think that's one of the strange things, the strange features of this disease, which should really prompt the consideration. I think your story highlights that really well. Ebony, it's obvious that you are an incredibly engaged and informed mom. I just wondered if you could maybe walk us through a little bit. What is your typical day like now when it comes to taking care of Orion and Osiris?
Every day, I wake up about 5:30 to 6, just before them, as close as I can, and start prepping meals. We do meals every 3 hours minimum and our maximum, so they don't go more than 3 hours without a meal. They keep drinks on hand all the time. We have included speech, occupational, and physical therapy in the homes, as well as diet-wise, keeping track of fats, proteins, and the amount consumed. And both were diagnosed with autism as well. So at the autism services, they also get the same type of, the teachers follow my same protocol I do at home, where they feed every 3 hours and they write down what he eats, they eat or drink, and then drinks are always set right next to him.
And has there been a time where they haven't been able to eat on that schedule, or have they gotten sick at all? in the past year or so that you can recall? I'm just wondering how effective is that regimen, and what sort of difference have you seen using it?
Yes, Osiris was in the hospital this March of this year, and I'm not exactly sure what the illness was, but it started with meta something. I'm sure you would.
Metapneumovirus, maybe?
He had metapneumovirus. He was in the hospital for 1 week before rhabdomyolysis kicked in. And then once that got bad enough, when his levels went up, he lost almost every ability of his motor skills. By the time of discharge, which was about 2 weeks, so he was in the hospital for 2.5 weeks. By the time of discharge, he could only lift his head. He almost couldn't open his hands all the way because he was in so much pain that he clenched all day. Over time, because I taught him sign language, his only requests were for drinks and foods for the first 3 weeks, all day, which was really great. It helped him bounce back. As of now, he almost has every single skill back. And it's been 7 or 8 months after barely being able to lift up his head.
And sign language is the primary way your boys communicate with you?
Yes.
Okay. Well, this has been great. In the interest of time, I'm wondering if you could tell me and tell us, if you were talking to a parent who just found out that their child has TANGO2, what is it that you'd want them to know, with that new diagnosis?
Firstly is you're going to walk out of that room with the same kid you walk in with. Next, you'll need a care team, a family circle, and you want it tight and to be where you need it to be, wherever your trust is, just to have it all. Go to every resource you can find and find those people who are out there who are willing to learn about you and your child and be with you and your child. Also, connect with all of us out there, all of us other parents. We will learn, we can share, and we will relate together. There are not many papers written about it. So we are the ones that are living with it. We can be the ones that can be the voice.
That's really important. And I really liked what you said. You still have the same kid. It doesn't change how much you love them and how much you care about them. It's just maybe makes your job a little bit harder on a day-to-day basis.
Yeah.
In terms of the schedule you talked to us about. What do you think we could be doing, as a medical community? What are some of the knowledge gaps that you've seen with TANGO2, and what are some of the things we could do a better job of figuring out?
When asking questions. When asking a medical professional questions, I'd want them to take me seriously, and to give me even an educated answer. I wouldn't want anything dumbed down, but give me everything you can in all of its intensity.
Yeah. So the communication piece.
Yeah.
And maybe being aware of what we don't know.
Yeah.
Yeah.
And want to be involved. Like giving the parents the newest paper or article written. Ask us if they've heard anything from other parents, make us feel related.
Well, I have had several patients and that's sort of a fluke given how rare it is with this disease. And I can tell you, most of my education has come from parents like you, just because we're learning every day. And it's so heterogeneous. You know, some kids can have these symptoms, other kids with the exact same problem in the same gene have a very different presentation. So it's not straightforward. Ebony, I wanted to thank you for sharing your family's story with us today. You know, with rare diseases, it's so important that we have parents like you to learn from.
Thank you so much.
Thank you all so much for joining us today and sharing your expertise with the child neurology community. For more resources, check out Child Neurology Foundation website for more content relating to navigating the new normal. Thank you both so much. We appreciate your time.
The TANGO2 Research Foundation was founded by my husband and I after our son Ryan was diagnosed in 2017. We understand what it feels like to get this diagnosis, and we know firsthand the frustrations and fears of so little being known about TANGO2. Our foundation is highly motivated to achieve our mission to improve the lives of those affected by funding, coordinating, and guiding scientific research that will lead to a better understanding of this disease. The TANGO2 Research Foundation is here to help the families, the medical professionals, and the scientific community in any way we can as we all work together to improve the quality of life for children with TANGO2. You can find us online at tango2research.org as well as on social media.